Three, two,
Alright, Assalamualaikum and hi everything. Welcome to Baloya series. My name is Shafiq Ghazali and I will be your moderator for this very episode of the Baloya series. So, tonight we are going live with YB Dr. Kevin Yu, a member of parliament for Bandar Kuching and a survivor of COVID-19.
yay!
A round of applause,
Hi
please,
guys.
ladies and gentlemen.
Apa khabar semua? Baik.
Good,
Bagus,
good.
YB. How are you doing today?
Very good, very good.
Alright. So, firstly, Omar, I would like to say thank you for joining us tonight in Kenyalang Prodigy's fourth installment of the Baloya series.
Thank you for having me.
This goes to... Alright, thank you. So this goes to everyone else that's watching our Facebook Live currently right now. So if you guys have anything to ask, do put your questions or inquiries in our comment sections on our Facebook Live. But set aside the political questions and comment as it will not be entertained for tonight's session. But not
Good.
to worry. Other than that, we will ask Yang Muhammad upon it personally. So,
Sure, no problem.
before we begin, let me introduce my friends who's joining us tonight. So, as I introduce you guys, do wave to the camera and say hello. Alright, boleh? Alright, so let's begin with the ladies first. We got Miss Laila Mustafa here, our former Secretary General. And then we got Miss Siti Nur Azbina, our member of the Kenyalang Prodigy.
Hi.
Mr. Fawzi Bolkia, our members, and then we got Fakrul Iman, our Secretary General of Kenyalang Prodigy, and then we got our special guest, I say special, BB Shahida, and my fellow friends, there is our President, Mr. Azim Rahman.
Hi. I have no camera,
So-
sorry.
I have camera, Azim. Alright, so
Man, you
without
fan,
further ado,
Yes.
can you share, Yang Muhammad, can you share with
Yeah.
us on your current whereabouts and well-being?
Oh, okay. Thank you so much first for having me on this forum. I think it's an honor to see each and every one of you, and I believe that young people are the change for our country today. I'm currently in my room, as you can see. So I'm alone in the room, so I do not have to wear a mask for any precaution. Unless maybe I risk infecting mosquito ke nyamuk ke cicak ke, I don't know who else in the room lah. But generally I feel well, and I've actually feel I feel well for the past few weeks. I didn't display any typical symptoms of disease. I was discharged last Monday. Today is Saturday, kan? Last Monday, and I'm at home right now.
Oh, I see. So, Yang Muhammad, we were all shocked when I personally received your video in which you had been diagnosed positive of COVID-19. I think last few weeks from second, right? So,
Yeah.
can you share with us what were your reactions during that time, and how did your family reacted to it?
So I give you a simple timeline of
Yeah.
how I found out and how the whole case went in whole chronology. So basically on the 14th of March. On the 14th of March, I remember it was night, and then I received a WhatsApp message from a friend in Semenanjung, Malaysia, basically a fellow MP, that told me that YB Andrew Wong from the YB MP for Surigay was diagnosed positive with COVID-19. So that was the 14th of March. So I started reflecting back when was my last contact with him. And I remembered that on the 2nd of March, I had direct contact with him. Basically, I had breakfast with him. I was in a meeting room with him for more than half an hour. And because of that, to take extra precautions, from that onwards, I canceled all my meetings, I canceled all my events, I canceled all my public appearances and everything for precautions. And I self-isolated at home. And I also seek the advice from the health department on whether there's a necessity for me to do testing or what's next for me lah. So they of course asked a few questions. I think that time the policy was not every patient has to be screened. They only count the risk factors. So my risk factor was that I had direct contact with a positive patient, and it's not just direct contact macam kita jabat tangan, senyum, take photo, hi bye and everything. But there were a few criteria questions that they asked me. Like they asked me, were you talking face to face with him more than 5 minutes? I was having breakfast with him, so obviously more. When I was in a room with him, was this an open air room, an aircon room? How big was the size of the room and everything? Was it more than 15 minutes? So obviously I was more than 15 minutes. I was in a very small room and we were quite cramped inside and it was air conditioned. So of course, they from these risk factors they count. And plus for the fact that the nature of my job, we see a lot of people in public. So they said that I think based on these criteria, I think it's for precautions. And as well as at that time, banyak rumors already spreading around. The people spreading our photos with him. And then a lot of the public starts to have concerns and some have a little panic and stuff like that. So we thought that the best idea was to get tested. So on the 15th, because I received the news 14th night, on the 15th itself, I went to get tested. I went to Sarah General Hospital. I did a throat swab. So there are two kinds of examination. There one is a blood, which is serological, where they detect IgMs or IgG, immunoglobulin M or immunoglobulin G. And then the other one is the RT-PCR, where they do a throat swab or nasal swab. Because we know COVID-19 is a respiratory virus. So it will be in your throat, in your nose, in your lungs, respiratory tracts. So they swabbed my throat with a long cotton bud, and then they did a lab test to detect the viral load or the presence of the virus on my throat. So that's the 15th. On the 16th night, I remember it's about almost before 9 p.m. I think about 8:40 p.m. I received a call from the hospital that informed me that I was tested positive of the COVID-19. To be honest, right, the first fear that came into me, or the first concern that came into me, wasn't about myself, but it was about the public. It was about the people and how would they react to this. Because we know that, especially now in this whole age, or this whole season of the virus, we see a lot of fake news being circulated around, and we see how sometimes panic is worse than the virus itself. So especially due to the nature of my job, of course, I attended some events before. I didn't know I was positive. I had no symptoms. I wasn't feeling unwell. So that's why I carried out my job as an MP in my constituency. I attended a lot of events. So I was so worried for the public. I was so worried how they react. And of course, the moment I released the news, there was a certain reactions. Of course, some good, some encouraging, some bad, some very bad. But at the end of the day, I never blame the public, because I understand the concerns. Everybody is concerned about not just on their own health, but concerns about family members that they are at home. Some of them have little children at home, and some of them even have elderly parents at home. So all these concerns and a lot of unanswered questions, and because we are still a lot of things we still do not understand about this virus, and you just accumulate all that concern. So I guess the reaction is natural. I don't blame the negative comments. Is fine. I understand the concern, but that was my reaction. I was like, man, I feel for them. Like I if I would have known that I was positive, I known that I had the virus, I would have never jeopardized another person's health or life and everything. Yeah.
So yeah, we are all aware about that. But we are all also glad that you are doing fine right now. You have recovered from COVID-19. So
Yep.
that's good to know. We are happy
Yeah.
for you too. So
Thank you.
maybe Yang Muhammad, maybe you can share with us your experience from day one of being diagnosed positive with COVID-19 till your recovery now. Maybe also you can share with us the symptoms that you had experienced or had occurred during the time.
Okay. So I received the news on the 16th. Then they straight told me to get admitted into the ward in Sarah General Hospital. So I was rather nervous because I don't know what to expect. Never been admitted to hospital, and what more is isolation ward. So I at first I didn't really know what to pack. Eventually I remembered, okay, my time in GH. So if anyone that's tested and needs to be quarantined, don't panic. Let me tell you what to pack. Okay? You don't need to pack many clothes. You don't have to pack many clothes because you have to pakai the clothes that they provide inside. So if you're isolation ward, there is this striped purple, white, like Ralph Lauren kind of design Sure. The general patients will wear green, but for isolation patients, we have to wear that prisoner's coat. The reason why is to identify. So if we are walking on the streets, they tembak lah. I mean, they won't. They just to identify lah. So of course you bring your toiletries and everything, your seluar dalam and your underwear and everything, and of course your laptop or book for you to kill time in the ward. So you don't have to bring much stuff. So in the ward every day, the nurses, I was given a room, my own isolation room. So I have my own room, I have my own toilets and everything. And the nurses and the doctors that come in to see me, they have to wear this full, we call it the PPE suit, the protective suit. On a daily basis, they take my blood. Okay, they take my blood to do a few tests. Okay, of course, on the full blood count to see my white blood cells, whether there is any acute infection, signs of acute infections. You see increase of leukocytes and reduce of lymphocytes. And also my LDH levels to see the recovery and the progression of the virus. Also, they take my vital signs, which is my blood pressure, my SpO2. SpO2 is the readings of oxygen in my blood. So, as I said, this is a respiratory virus. So, if a respiratory virus and if it's progressive in my body, that means my lung function is affected. That means the oxygen level in my blood is reduced. So, they take that, they take my temperature on a daily, twice a day, and all this. So, in that whole 1 week, in the ward, actually, I didn't really experience any typical symptom of the virus. I had no fever. My daily 2 times check, I had clear fever, clear temperature. I got no cough. I got no flu. Lung auscultation, the thing that Dr. Pakai, they check my lungs. My breathing was clear. No signs of wheezing or any signs of congestion. I did a chest X-ray on me as well, to check for signs of pneumonia, which is the most common complication of the virus, and it was clear. And my bloods was clean, and for the whole week. So that is why they said monitor me first. They did not actually prescribe me a specific treatment. Different patients have different treatment based on the symptoms, based on the severity, and of course based on the discretion of the doctors. Some patients, I was informed, were given IV antibiotics, mainly to treat the pneumonia, of course. Some were given hydroxychloroquine. There was some maybe interferon. Hydroxychloroquine is an anti-malarial drug. So this has been very effective and useful in countries such as France and the US as well. So it must not be confused with the chloroquine that Trump announced and then somebody actually took the pawn thing and mati. Right? It's a whole different thing. Hydroxychloroquine and chloroquine is different. But these are the few treatment regimes that I think our country has. Then the doctors would choose which is best. They are learning from different countries before. I think now they are taking a drug from China called Alviran, if I'm not mistaken. So different countries have different treatment regimes, and we are still learning because this is a new virus. But for myself, the only advice the doctor gave me was minum air and banyak tidur. So I rest and I drank a lot of water. I think on the first day and the second day of the whole quarantine, I slept for the longest time in many months. So it was a good reset for me. It was a good rest for me, and that's it. And on the 4th day, actually, because I was active, I tried to be productive in the room. I answered a lot of calls, a lot of messages because people were concerned. So I tried to answer as many questions as I can. I do Facebook updates to update on my situation to show that I am fine, don't have to worry. I was asymptomatic, so the doctors did inform me that the likelihood of me being infectious to other people is lower. Of course, we cannot say 100% I'm totally uninfectious, but because I'm not coughing, I'm not sneezing and everything, my droplets are not spreading around that easily. So hopefully that I was so not infectious. And the good news was my wife, who I spend close contact almost on a daily basis, we sleep in the same bed, we stay in the same house, was tested negative as well. My father was tested negative. My assistants that follow me to work and same office and follow me a lot where all of them tested negative. So that was an encouragement to me. So I also update this to the public to keep them give them assurance to not to panic, to follow the instruction and directions by the health ministry. Because one of the things that I do in quarantine is to list down all my my contacts, my events and everything. So I'm lucky that I have a schedule. So I just schedule down every my events. I list down as many people as I can remember. Of course, you cannot remember people, you shake hands and come and take photo with you. But as much I can, I write down. And normally what the health department do is they will decide on who are the main risk factors. As I said, it's not just taking a photo or waving, but there are a few criteria they fulfill. Then they will normally give them a call. And if they are symptomatic, because as I said, there are two different tests. So sometimes the test is more effective or more accurate if there is symptoms. So if there is no symptoms, the likelihood of a false negative or even a false whatever false is higher than normal. So that is why at that time the policy of the government was to only test symptomatic patients.
Oh, I see. So, would you say that your early goings to the hospital does help your chance in recovery?
I think the hospital did the right move. I think many people did ask me, since you had no symptoms and everything, are you sure the test was correct? So for me is whether the tests are correct or not. That's not the question we have to ask. But as a doctor, I mean, I was trained as a medical doctor as well. The moment we receive a test, and when it involves an infectious disease, it's always important to lean on the safer side. So I got a test that shows this patient is positive. I need to quarantine. I need to take proactive steps. So I applaud the health department. I applaud the doctor's decision to quarantine me, to be proactive in doing that. So whether I was I mean, as I mentioned just now, so in the quarantine ward, I didn't really take any specific treatments. So I could have done what I did in the ward at home as well, quarantine myself at home. But again, the doctors did the right move to isolate me at that time because they didn't know. They didn't know what level or what is the progression of the virus in my body. I could be asymptomatic when I tested. Suddenly, in the next 3 days after that, I deteriorated and cannot breathe and everything. So it was the right move for them to isolate me and to monitor me in that way.
Oh, I see. So as you had been, how do you say, like, you had been recovered from this COVID-19. What did the doctors say to you?
So basically, to be discharged from a quarantine center on the 4th day, they moved me out of the ward. So I was in the isolation ward. Isolation ward got CCTV then. So CCTV because the doctors and the nurses can monitor you just in case any emergency.
Yes. So
basically, they see me do. I was so bored. I did planking, like I did burpees and everything. The nurse complained, "Kenapa you active sangat?" But after the 4th day, they realized that I was stable. So they needed the ward for patients that were more symptomatic. So that was true. So they transferred me out to actually quarantine center at Pusat Belia dan Sukan, belakang Sebekas. So I was given a room for myself as well, a toilet, because we are still in isolation. But in order for me to discharge, the doctors say that I need to do the PCR test, I mean the throat swab, against 2 times in a span of 24 hours. So my last 2 days, the last 2 days I did two swabs. One on the day before, then one on the next day, and then one day I had to wait for the results. So only when those 2 swabs in the span of 24 hours is tested negative, then only the doctors make the decision, the informed choice, to discharge me back home. But of course with precautions. So to be extra safe and extra precaution, I think because of what happened also, I don't think the public want to see my face also. They see me, they lari jauh-jauh. So to take that precaution, I quarantine myself at home. To be extra safe, I don't sleep in the same room with my isteri, kesian kan. I don't eat during I don't eat with my wife. We eat at separate times. We try to keep our contact very, 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 very limited. When I'm in a common area with her, I wear a mask just for precautions. But when I'm alone, I don't. But with her, I wear a mask. So we take a lot of these precautions. And also, the doctor recommended that 2 weeks' time, I go back to the hospital for another final testing. And if that test goes back negative, again, that means 3 negatives in the span of 2 weeks, then inshallah I should be recovered. And then, of course, there were discussions saying that whether I would be willing to share my blood plasma. Because in China, they use this treatment, patients that have recovered for their blood plasma as treatment for other patients. So I cakap, okay lah, whatever you need, just take, you nak potong, saya pun ambil lah, semua ambil, as long as it's for the good of people. So the theory is this, I mean, in general, I mean, if a medical background, you understand the theory is this: if you recover from an infection, your body will develop antibodies. So I in theory, of course, if the virus mutate and we don't know but in theory, I should have immunity from this virus for at least 6 months, 6 months to maybe 8 months to a year. So that's why they say you are the luckiest now. You nak pergi mamak tu, you nak pergi makan, everything you are safe lah.
After recovery.
So I actually have a crazy, not a crazy idea. I want to give back to the medical people, and I don't know whether they're willing to accept me. I mean, if I have immunity, why not I volunteer on the front lines as well?
Oh, that's good. That's good. That's a good one. So, as shared on your Facebook Live, and you had mentioned the doctors, right? You really had shown appreciation towards the frontliners, especially the doctors, the nurses at the Sarawak General Hospital. Maybe you can tell us about your experience and observation with the frontliners in the hospital during your time.
I think one of the privilege for me to be in quarantine is to able to observe our medical workers, frontliners, doctors, nurses, medical assistants, cleaners, even cleaners. You know, our isolation ward, when a patient change, they have to specialize cleaners and everything. So these people, they turn up on a daily basis to work. You know, every time they come in, you know, I'm a talkative person lah. So I always go with their life. I ask them, hey, what is your how's life? What is your name? And because I want to understand their story as well. I think story is very powerful. So actually, a lot of them tell me that, you know what, I've been here for 7 days. That means they tak balik rumah dah. So you see, these medical workers, they are just like us, you know, their families back home. Some of them have young children back home. Some of them have elderly parents. They are living with them. So they are afraid on a daily basis that they will bring back this virus back home after work. So you see, even with this whole risky situation, even with all these concerns and anxiety that they face, right, they turn up for work every day. No complaints, work dedicatedly, committedly to make sure that people like us are treated, taken care of, and the whole community itself is protected. So I tell you, right, I mean, sometimes we read news and we get discouraged by things that's going around. We discouraged that some makcik ke, auntie ke, or even young people that lepak even though it's MCO. But when you see these healthcare workers, right, turning up on a daily basis, working hard even in this kind of environment, right, I tell you, for me, this is the best of humanity. We see the best of humanity being displayed. And that gives me the positivity, that gives me the encouragement to keep going on and to do my best to give back to them. So that is why after, even if I'm discharged, right, I have a lot of friends in GH, a lot of old colleagues. So it's very funny that they message me and ask me stuff. But anyway, so they will ask me about, I'll ask them about what can I help for the GH? What is there needed to the GH? So that's why this whole 1 week I've been trying to coordinate donations into GH. We raise up funds more than 100,000 to buy equipments to give the GH, PPEs, face visors, face masks, boots, we call it IV infusion pumps, automatic suctions, all these equipments that is so needed in the ICU, especially for these COVID patients. Not only COVID patients, any other patients in ICU. So this is one way that we can mobilize as a community to give back for all that has been given to us by these frontliners.
I see. All right. As a professional in doctors yourself, based on your observation during your quarantine, what can you suggest on improvements that can be done to help the frontliners?
Maybe we have a better Wi-Fi in the ward. This is real, man. I don't have Wi-Fi in the ward. The only line is my phone, and it's mine. I'm on DG lah. Okay, DG may kill me. DG is stuck in the ward lah. No line at all. I tried to do Facebook Live when I was inside, but tak lalu. I record a video I want to send. It takes 20 minutes to upload, so it's really bad. So maybe to make life easy for that, I don't know the Wi-Fi. But in terms of services, I have no complaints. I think they have been top notch. They have been very professional in what they are doing. The fact of the matter that even the people that prepare my food, a lot of people ask me, how is the hospital food? How's hospital food? Is it bad and everything? Let me tell you, right, it tastes the best food that I've eaten. Why? Because the people gave their best to prepare for us. So breakfast, lunch, dinner, I wallop semua in appreciation for all their hard work.
Alright, so right now I'm going to open the session with my friends that's joining us tonight. Maybe you guys have the inquiries of your own. So the stage is yours. So thank you.
Any questions?
Hello,
Anything?
Azmina.
Me.
Hi.
Hello, YB.
Taba. Hi.
Hello. Sabar. So I got one question. So after you recovered, right? Did you consume any supplement as your body resistant macam vitamin C kah that recommend by kesihatan or doctor? Okay, that's all.
I think in general, any viral infection lah. I mean, COVID is just one of the many viral infections that there is. But in general, the common flu lah, influenza lah, whatever. The main thing that we need to fight it is our immune system. So like for me, some people say, how you recover? You got no medication. So the answer is my immune system fought back against it. Everybody has immune system. So the best way to fight a viral infection is to improve our immune system. This way, normally when you get a simple flu, and when you go to the doctor, most of the time doctors don't give you obat one. If they give you antibiotic, those are not real doctors. Generally, a viral infection, they will ask you to rest and stay hydrated and really boost your immunity. So that is what we can do. Vitamin C helps boost our immunity. I do take vitamin C. I take about 500 to 1,000 mg a day. Don't take too much vitamin C. I know some of my friends that message me, we need to boost our immunity. We pump in 2,000, 3,000 mg of vitamin C. I say, you gila lah. If you take too much vitamin C, one of the most common complications, actually there are many different side effects or complications, but the most common one is diarrhea. So if you eat 2,000, 3,000, I tell you, you enjoy your timeline. So you just do live as I said, boost immune system, vitamin C, stay hydrated. Okay, ice swamp cannot kill the virus, but our body needs water for our general well-being. So for example, our immune systems need water. So what I normally recommend is when I was in the hospital, I drink about 4 to 5 liters a day. Okay, you jangan minum 5 liter in 1 hour, like your kidney will overload. So in general, your kidney can actually clear, in average, about 2 to 3 liters of water an hour. So don't drink that much in that hour, maybe drink 1 liter in 1 hour. Or no, not 1 hour, maybe 500 mils in 1 hour, and you keep drinking and drinking to boost your immune system. Keep a healthy lifestyle. Even though MCO can try to do exercise, I was doing planking, the simple exercise to keep myself active. So boost your immune system.
Okay, thank you.
Yeah. Any more questions?
YB,
Don't be shy.
YB, Aziz
Yeah.
here. This one I think I read somewhere that they take the sample. You mentioned just now using the swab, the panjang swab. Sakit ke YB?
Mak cuba kah? I think it's a lot of people ask me, they say very sakit and everything. Actually, it's not really sakit. It's just inconvenient. Okay, I say it's very easy for you to test out. You know what bulimia is? Bulimia is a psychiatric condition where some, especially it's boys and girls, but majority in girls, where they takut gemuk, they go and after makan they choke themselves to vomit. Okay, so anybody have tried to choke themselves? So basically, it's the same discomfort. Because the throat swab is a long cotton bud, it's like a cotton bud. They put it down to your throat. You know, kalau you buka your mulut, you'll see your tonsils there, your lidah there, and your tonsils there. They just basically they use the cotton wool to rub that area. So the only discomfort, actually, I feel like gagging. I feel like gagging because muntah lah. So it's not like sakit, like people punch you, people cucuk you or anything. It's just the gagging feel. So I said, if you want to experience it, you muscle your tongue, and then you get the same discomfort.
YB, another question. This one I don't know lah. I don't know where to read on this, but I heard that when you take you do one testing, it costs about 700 ringgit, if I'm not mistaken about that. That's the cost. But how much do we need to, as Malaysians, do we need to pay if we test ourselves? Do we need to pay?
If you do it in GH, it is free. I said there are two different tests. One is the serology, which is the blood, where they take your blood, then they drip it on a little thing. Sometimes it's white color and everything, and then they would determine the level, whether there's IgG. Immunoglobulin G basically shows that it's an acute infection. That means the virus has started affecting you. So this is when your symptoms and everything is very clear. Then or they'll detect IgM when it's already chronic. That means it's already recovering, like this antibodies is forming. So those tests are cheaper. If I'm not mistaken, in private hospitals, those tests are maybe 100 ringgit, 150 ringgit. The 700, 800 ringgit is the RT-PCR test, where the throat swab. Because now throat swab, you need to send to the lab. There is a special machine to check and everything. So those are the 700, 800. But RT-PCR is more accurate. So in GH, RT-PCR because it's more definite.
Yeah.
Yep.
Okay. It's my turn again.
Okay,
Can I?
baby.
Okay. Alright. So because
Ladies
I got see from social media in which the patient that who died because of COVID-19. So my question is it the virus is still alive in the human body after the host is died?
No. In general, virus, bacteria, and everything, they're in our body because they need a living organism to live. So if a person dies, of course, I don't know exactly how long after that the virus dies. But in general, if a person dies, they will eventually, the virus will die. And that is why actually infectious disease like COVID, right, is a very sad condition, especially the moment, for example, I was tested positive, I cannot quarantine. I was pulled away from my family. I maybe say bye for my wife from a distance, but I was quarantined. But if I develop more serious symptoms and eventually I pass away, no one is allowed to see me, come close to me. So even the family members tak boleh kan. So it's like it's very painful because you have no chance to say goodbye now. So from what I understand, the doctors would call you on FaceTime and call you and everything, trying to say goodbye. But then it will never replace the personal touch. So that is why it's very painful. But there are also ways that they have to uruskan the perkebunan, they arrange the funeral and everything, and there are ways to for the body to be handled the moment the person passes.
Because I got heard from I got read now from our social media. This one case in Indonesia, they said that this jenazah is suspected to have the COVID-19, and then they already cover the jenazah. But then when they reach at the kampung, they open up, and then they want to clean the jenazah, and then the whole kampung affected with COVID-19. You got heard that one?
No.
Oh,
We
don't
have to verify. We have to verify whether it's true. But as I said, it takes a few hours for the virus to die eventually. Because even for example, when I died, and the most common complication, of course, there are a lot of other reasons. Is the lung fail and everything. But then my other cells, for example, in my lung failed, my heart, I had heart attack and died. So my heart cells probably died, but my other cells may still stay alive for a few hours. Of course, after no blood, you will die, but you must stay for not maybe for a certain period of time. I don't know the exact figures, but you must stay for a period of time. So at that period of time, the virus or bacteria or whatever may still survive, but eventually it will die.
Better to prevent than cure.
Yeah. So I it depends again. I know in the Muslim faith, you're not allowed to cremate. My understanding, especially infectious disease, the general I'll say recommendation is cremation, but again it depends on the faith that the patient has. So we follow that. They have proper ways to handle it.
Alright, thank you, YB.
Yep. Any questions?
Anyone
Mine.
else?
Laila.
Please, you have questions?
I
Alright, so
Shouldn't
Okay, moderator, up to you.
Alright, Sofina, Azim, I think it's Sofina want to ask a question there.
Yes.
Sinar.
Suaranya. Suaranya pun audio. Yang pun audio.
You have to unmute yourself.
Yeah, so kita unmute Tampun so.
Ya. Atas sana ada bodoh. Okay.
Yes.
Okay.
Hello, can't hear you. Sorry. Dapat dengar?
Those boys.
Kena on volume kot. Saya dah.
Okay.
Alright,
Try to get
okay. Maybe there's like a line
YB. Hello.
Yeah.
Okay, YB ada tengok si Dak Nas, doktor yang cram dengan situation yang ada dekat hospital. You see, yang tension or fed up dengan ada certain patient yang spoil or mengada-ngada.
Memang aku dengar ada macam rumours ura-ura ada patient yang macam nakal sikit lah. Mereka si dengar apa doktor padah semua kan, they don't follow the advice and everything. Memang kita ada dengar orang-orang macam tu lah. I hope lah I'm not one of them lah. I gave the best cooperation. Whatever they ask me to do, I said whatever you need to do, I do lah. For me also, I told them walaupun aku YB, saya ada professional treatment lah. You mau letak saya tidur mana, letak tidur lantai ke tidur jalan raya ke mana pun letak mana lah. So but there is of course patient yang not very cooperative, and this is where there are few that actually called me and complained. Patients tau, I told them, hey, please lah, listen to your doctors. So luckily after that they cooperate more lah. Because as I said, this is a very high stress time. Not just for the medical workers, but also for patients. Those patients, they're confused. So they react. Sometimes they scold the medical workers, which is of course I don't condone at all. I always ask them, please cooperate with them. But again, in front of me, the doctors have been super professional. As I said, it's a very high tension, high stress time for everybody. Everybody is concerned, but then in front of me, they're professionals. Doctors, as I said, they have been acting the highest professionalism. So even I know they are nervous. I know when I went in, there are a lot of cases. There was people, a lot of panic and everything. But then in front of patients, they exuberate or they show a lot of confidence and professionalism. So that I thank them for. Walaupun bawah mungkin nervous kan or panic kan, but in front of patient, they are professional.
Right.
Thank you.
Anyone else? No.
Can
Alright.
anyone hear me?
Dapat
Can
finally.
you guys hear
Dapat
me?
dah.
Okay,
Yes.
sorry.
Dapat
Okay,
siapa?
my name is Sofina. Hi, YB. So I would like to ask, because I actually read few articles. I mean, like people's posting in Twitters about their experience in going through COVID-19. So I would like to ask, do you think like having a positive mindset? Because I know like currently now people have that kind of a stigma when like if you have COVID-19, you're definitely gonna die. So and then one of the ex-patient actually shares their experience whereby they said that in order for you to, apart from ensuring that you have to ensure your heart metabolism and everything, you need to make sure that you have a very positive mindset, because that is one of the things that ensure you to get through all the process. So what do you think about that?
Yeah, I agree. As I said, what is most important is for us to boost our immunity. Of course, you cannot just have a positive mindset and then and don't take care of your health, don't eat the ubat and everything. Positive mindset alone cannot cure the disease. But having a compilation of good mindset, good mentality, and also good physical health, as in taking care of your lifestyle, eating the medications that you need, is important. Because there is this term in the medical world called psychosomatic. Psycho means your mind, and somatic means your body. So we often say that sometimes you see a patient who always think that, oh, I will have this disease, I will have that disease, I will have that disease. The tendency is, of course, it's not 100%, but the tendency is that person will have the disease. Because your mind keeps thinking that you have the disease, your body will manifest sometimes the symptoms. So we call it psychosomatic. So why I think it is important to keep a positive mindset is because See, one of you mentioned correctly, and I've been speaking out very vocally about this issue, which is the issue of stigma. And this is not just stigma on patients. Okay, you see, patients they not only have to worry about their own health. Like somebody actually asked me, has death? Do you think about death when you have it? For me, I was very lucky, alhamdulillah. I did not experience many symptoms. That is why I never really thought about death. But if I was, for example, I told him fast, and then I had to put a tube in my trachea, for example, I think maybe at that period of time I would think of death. And some patients have to go through that. So it's not only this, the fear of all these unknowns, the fear of my body deteriorating. But let me tell you, there is another fear that people is facing, patients especially, is a stigma by the community. Imagine, you see now, for example, if an ambulance appear next your next door neighbor at your house, take in a patient, what is your first reaction? Yeah, make it jangkit, or I must stay very far. The whole family tak boleh, somebody cannot come out. So you see, they start judging, they start pandang rendah, they start putting some kind of label on them. And then after that, people will score them on. You start thinking like, oh, last time why she go and come to my house? Why she go and do this? Even though that we know it's not their fault. And no patient, let me tell you, no patient wants to be sick, wants to get a disease. And no patient wants to spread it to another person. Okay? That's why I even the few clusters, the tabligh clusters, the different clusters, I said, please do not condemn them. Do not look down on them, because not only you are putting a stigma on them, but you are actually discouraging the rest of the community to come to test. Because you say, kenapa saya mau test? You look at my friend, they kena kutuk and everything. Why must I stand up and test? I don't want to go through that stigma. So you are discouraging people who may need to get treatment, and then you are putting extra stress on that patient itself. I say he's just thinking about himself, his health, but he has to think about what the community, rumors, and everything. So this is why we need to understand. We need to care and support them through. Okay, I mean, this is something I'm passionate about, and I talk to you about it. There are few fears that a patient has to go through, and I go through the same thing. Of course, number one is the fear for your own life. For me, it wasn't so bad. But the fear that I tell you, I can share with you, is the fear of what we call the spreader's fear. Spreader means menjangkiti orang lain. So I tell you, every day when I read report, the daily report, I tell you my heart debar like crazy, praying that I do not infect another person. Because I tell you, the guilt, even though we know, every day I tell myself, it's not my fault. But I tell you, the guilt, right, of seeing you affecting another person, and even worse, if that person eventually passed away. Oh, I tell you, it is a huge. And then I recommend. Actually, I understand how the certain governments they will put reporting, right? They show you who they jangkit, how jangkit everything like that, right? For the general public, we like to see it because we want to see, come from where we're interested. Yeah. But you try to put yourself in the mindset of a patient. If I see myself for example, number 80, and then I jangkit, imagine the emotional stress. It's like we call this the spreader's guilt. So even though it's not our fault, it's out of our control, but we have this guilt, and even worse if the person passed away. Another survivor guilt. Another thing we call survivor guilt, and this is often seen in a post-war army. It's like, for example, they go to war with their partners, with the same battalion. They all died except you. I survived. So, for example, in the same, if I have this disease, I jangkit to my family. You know, macam kat Sarawak, we have one cluster of family that passed away. The source didn't pass away, but 3 of the family members passed away. Kan? Well, I tell you, I feel for this person. I really feel, because I survived. Tau. Disebabkan saya, mereka sakit dan ada yang meninggal. Tapi saya masih I tell you, I really feel for that person, whoever he or she is. The guilt, I tell you, is crazy. So that's why I said, in order for us to get through this war, we are war against something unseen. We have to be a supportive and caring and loving and empathetic. Empathy so important for these patients. So it's very easy to kutuk, to hentak. Apa mereka ni tak bertanggungjawab di sana. I tell you, okay, there are some memang they know but they refuse to reject. Of course, those are irresponsible. But in general, I tell you, patients, I don't think anybody would want to be infected, and even worse, I don't think anybody wants to infect another person and jeopardize another person. Like even for me, I keep thinking back, man, if I knew, I wouldn't have done this. If I knew, I wouldn't have done this. But I never knew. But then that guilt is real. I'm sharing a personal experience. That guilt is real.
Okay, thank you.
Yeah.
This is one of the questions from our members. So he stated that what are your comments on the RMO that had been extended?
I think, of course, I believe it's a good move. I agree with it. On a public health side, it's of course very important. Even the Director General, Dr. Noor Hisham, for me, he needs to be knighted after this. He is amazing. He's done a great job. He has said that we are even expecting a surge or another wave even next month. Actually, there's a report by JP Morgan that says that the third wave will happen in the mid of April, which is next month. So because of all these concerns, and also another report saying that there was a kementerian that more than 8,000 of their workers went off during school holiday, went overseas. So it's like with all these risks coming back and everything, the MCO, in my view, on a public health side, is needed. It's really needed. Okay, but we understand an MCO on the health side, this issue is not just a health issue. This is also an economic and social issue. So the more restrictive MCO we have, yes, we will, they call it, we flatten the graph. Okay, we flatten the graph on the health side, but the stricter the MCO is, the graph of economic recession actually peaks even higher. That means more recession, more kawalan pergerakan, more MCO, more economic impact. So this is where the government must look into to elevate some of this economic impact. Because I tell you, I've written this today and yesterday because I was listening to the PM's announcement. The one thing that I'm very concerned about is employment. Because I'm generally, my philosophy, I'm generally pro-labor. That means I for the hard project. But in order to maintain employment, this is the time for us to take care of the employers. We need to incentivize the employers not to retrench, not to sack the employees. So because I tell you, right, with employment, I'm sure there may be revisions of salary, bonuses, semua. I don't think there will be anymore. But as long as there is a basic salary, you give a chance for people to put food on the table. But if you don't have salary, you don't have employment, everything, I tell you, we will have, they're even predicting 1 million loss of jobs. MIER, which is the Malaysian, another think tank, predict up to 4 million loss of jobs. For me, this is very bad because this will throw our country not just into economic recession. This may increase our social problems because unemployment, people don't know what they go out and do. But these are issues that we really look in. But on a public health side, MCO is needed. But we need the government's help and aid now to address the economic issues. Because MCO, for us like this, we are okay. A lot of us that have fixed pay. For us, MCO macam cuti je lah. Stay at home, I still get my pay. But for workers, daily paid workers, kalau tak pergi kerja, tak ada duit. Hawkers, kalau tak pergi kerja, I don't sell my stuff, tak ada duit. All this low B40, and these people are B40. Majority of them, kalau sakit, they cannot see a doctor. I mean, of course, go GH can lah, but generally in private, they cannot see a doctor. So these are the people that are most vulnerable. So even MCO, like in my kawasan, a lot of people call me and say, doctor, YB, we are starving. We tak ada my family used to depend on my son for income. He's a painter. And now we know no job, cannot paint and everything. So they don't have money. So tak boleh beli barang. Some of them don't even have transport. Some of them, their food is sent to them by their children once a week. And now because MCO, the children cannot come and see them, they got no food. So it's like all these things we really need to address and take care of the most vulnerable. So I now with enhanced MCO, especially in Simpang Regam in Johor, I think there are conversations that may even enhance control in different areas. So I'm very concerned. Aku harap kucing tak kena lah. Actually, if you look at the numbers, Kuching is not that encouraging. Like Kuching quite high the numbers.
I mean,
that is why we must abide by the MCO. I mean, if this kind of situation kita tak abide, habis we kena even teruk, nanti kita semua lah kena. So hopefully not lah. Kita berdoa bersama tak ada lah.
Alright. So maybe you can comment again on the fake news. Maybe you have an advice for the people here.
As I said, actually, panic sometimes can be worse than the disease itself. So now is an age of fake news and misinformation. Fake news is termed by Trump. We call it misinformation. So that is why I always advise people, especially WhatsApp. I cannot tahan. Do not simply forward a WhatsApp message unless it's verified. Because not everybody can WhatsApp, type something. Everybody can say something on a voice note. Voice note, not voice transfer forward like anything. And somehow, sadly to say, a lot of these people that forward to me are the older generation, 50 plus. Yes, very. Especially the good morning photos. Please stop sending me good morning photos. But this is the reality that we're living in. More and more people are start forwarding, and they create panic. Okay, as I said, one of my biggest concern when I announced to the world that I was positive, I felt that it was my responsibility to be transparent to my voters. But when I announced to the world, my biggest concern was panic because everybody started, wow, that day I got take photos. Some people say that that day I hoist IC, so I need to get checked. But I say, no symptom. No, I hoist IC. I mean, like, so you see all this panic, right? And then it makes the whole area tense. And then some people start lashing out at the medical professionals, the medical workers, who kesian them, they're just doing their job and cannot lash out. So you see, sometimes panic itself can create more harm than good. That is why, and for me, my rule is this: you forward me something, I say, wait, is this from? Is it verified? Not verified, I won't forward again. So the buck stops at you. So we know our friends, we know some friends, I know some friends that are memang tendency banyak lah. I always call them you fake news monger lah. but if the buck starts with us, it says that please don't forward, or we ourselves don't forward anything that is unverified. But the extra layer of protection, I normally challenge myself. When I read the information, I say, by forwarding it, will it have more benefit or harm? If it creates more harm, there is no point for me to forward this. So sometimes it's a human nature. Sometimes we want to forward to get people's response. We like to see when we forward, people say, betul ke? We like to see people. But as I said, at the end of the day, does that bring benefit to the community? So if it does not bring benefit to the community, don't do it. If you're not sure, don't do it.
Alright. As we're talking about giving back to the community, in the perspective of NGOs, what are your comments on NGOs that wanting to contribute, but there's some orders that we need to
MCO, and we can't do any. So yeah.
Actually, today Yang Berhormat Ismail Sabri, our defense minister, and also one of the Menteri Kanan, make announcement that NGOs now are not allowed to give out any help, and every help has to go through Jabatan Kebajikan Masyarakat. Look, the reasoning is, I totally understand. Reasoning is that we want to reduce exposure and everything. But I have a lot of concerns. As I said, I shared just now. In my kawasan, banyak orang yang telefon saya, say, I need help. I really need help. Saya tak ada duit nak beli makanan. Anak saya sekarang tak ada pendapatan. Saya tak ada duit nak beli makanan. Saya tak ada transport nak pergi market nak beli. So this needs are real. So my concern is this. Yes, I understand why NGOs, the exposure risk is needed. But you see, in every war, everybody plays a part. So we have the frontliners, we have the last defense line, and we have those, like, for example, like in Second World War, do you know that the majority of the workforce were women? Because the men were out in war, so the women had to make the guns, had to make tanks, had to make the suit, whatever. So it's the same now. So the government is busy trying to fight the pandemic. The frontlines are this. I believe my personal view, I believe NGOs have a role. Because it is impossible, Jabatan Kebajikan Masyarakat, okay lah, I won't say impossible, sorry. It is very difficult for JKM, Jabatan Kebajikan, to cover every corners, to make sure no one left behind. It's not because they lembab ke or anything, it's just there is workforce. They don't have cukup tenaga kerja. But then you have now a group of NGOs that are enthusiastic to give back. But with that said, like even my office, we deliver food to the poor, but my strict instruction was there, number 1, mask, number 2, you cuci your tangan, every house you go cuci tangan, you keep a social distancing, you cannot go peluk them or anything, just pass at 1 meter and everything. So you must adhere to these strict precautions. Okay, and that the NGO must adhere to. Take the next step, every time you volunteer, you do a temperature test. So all this has to be taken. We cannot compromise on safety and precautions. But I personally feel NGOs does have a role to play. Any agency has a role to play. As I said, like in Second World War, everybody played different parts. I think in this war, every one of us should. There is a room for us to play lah. So of course, while the restriction is the reasoning is understandable, but I think we can work around it and see how we can mobilize more people into this.
I see. All right, thank you so much for that. So I guess that would be the very last question for tonight. So Yang Muhammad, Dr. Kevin Yee, maybe there's something or a few last words that you would like to share with everyone that's watching us tonight.
Okay, thank you so much for having me. I hope you guys learned something. I see young people as not just the leaders of tomorrow, but you guys are the leaders of today. So I just hope I can inspire you sikit to step up in doing what you guys are doing. You guys are changing the world. So especially in this COVID time, I think we, even young people, have a role to play. Let's advise our parents, let's advise our family, friends to abide by the MCO. Stay home, stay safe, stay hydrated, boost our immunity system, and actually let's be creative. Let's not use this. Ini MCO kita ini bukan masa cuti dah. But let's young people, let's challenge ourselves to be productive during this MCO. Pick up a new skill, learn a new knowledge. Like for myself, I said that I got now more time. I wanted to learn something, so I signed up a course in Imperial College on COVID-19 on how they deal with it. So you sign up. There's so many courses online, free. Some okay, pay a little bit or certificate, but challenge yourself to learn something. Because I say after this whole this is not a 100-meter sprint. We are in it for a marathon. I think the effects of this virus is gonna be a long-term thing. And the normal we used to know before will not be the normal then. So in order to adapt, in order to excel or to succeed in those times, it's gonna be a very tough time. We must be able to equip ourselves, prepare ourselves, and also increase our knowledge. That's why I said learn as much as you can. Now you have more time, learn. Netflix tu boleh, tapi jangan banyak sangat. Nak semua tu K-pop semua kurangkan sikit. I'm not saying you cannot, but we harness this time to learn something new so that we can adapt when the times are tough. Because the normal before will not be the normal again. Trust me, we are in it for a tough time. So how are we going to respond will determine how well we will do in the future. So I'm not painting the future as a doom and gloom and everything, but we look to the future for purpose and to plan. So in order to excel in the future, we need to do what is needed in the present. So that is why prepare yourself, equip yourself, and God bless you.
All right, thank you. That's all, folks, for tonight's session of Baloya series. I would like to thank our panelists, Dr. Kevin Yee, for being here with us tonight and sharing with us his personal experience being a survivor of coronavirus COVID-19.
Thank you.
I hope everyone can benefit on our sharing today. Thank you, Shishini, Andre, to everyone that's watching us tonight. Stay at home, stay and stay blessed. Adios.
Bye.
Adios.
Bye.
Guys, learn something.
你很好，maybe